The testing, so there are two ways to get tested. There's testing at the Tennessee Department of Health, and there's testing through commercial labs, which is now available. The testing in commercial labs is new. It's a new test, and it's rolling out slowly. So it is a little, some doctors have it, some doctors don't. So all of the hospital systems and the providers are rolling that out slowly in coordination with the labs that they use, and are getting ready to be able to do that. The other nice thing is that the restrictions on how to test were changed. So your doctor can safely test you in the office without special equipment in a negative pressure room and all this other stuff that was required before. So it's going to be slow and it's going to take time. So I think a couple other things though. Doctors don't actually do the test in their office. We don't actually do the test here. They collect the specimen, and that specimen either gets sent to a commercial lab or to the Tennessee Department of Health lab. Tennessee Department of Health lab is still restricting who can be tested based on risk factors, and those are exposure to somebody who's a confirmed case, travel to an at-risk area, or in some cases people with a severe pneumonia that they have no other diagnosis for, but those folks are going to be hospitalized. So we understand that frustration, and we're working really hard with the hospitals and the health systems to get information out to doctors' offices. They're working really hard to get it out there so it can start being used. But whenever we have a new test rolling out, there's always a little it's always challenging. We are able to collect some specimens here, but again, we'll be collecting specimens for those highest risk folks who fall into those categories I just mentioned to send to the Tennessee Department of Health. If you have a respiratory illness, fever, cough, right now in Tennessee, you're more likely to have the flu than you are to have coronavirus. That being said, give your doctor a call and let them know that you have these symptoms, and they can advise you on whether you need to come in or don't come in. If you're not sick, you don't need to be tested for coronavirus or flu because you're not sick. The viruses make you sick, and so only people who are really sick should be tested. The other thing to think about is that everybody seems to kind of want to change their behavior and go get seen or get a test. So a couple things about that. One, people should follow what they would normally follow. If you're sick enough to go see your doctor, call your doctor and go see your doctor. If it's something that you would normally just stay home and weather it out, stay home and weather it out. We really want people to stay home and not go to work and not share germs. So don't change those behaviors. What we do want people to do is stay home if they're sick, and that might be a change in behavior for some folks because a lot of folks go to work and weather it out. So we do want people to stay home if they're sick. And the other thing is testing doesn't cure you. It doesn't get you access to anything other than symptomatic treatment. The only treatment for this illness, there's no antiviral, there's no vaccine, is symptomatic treatment. So that means, over-the-counter meds, cough meds. If you get severely ill, obviously you're going to have to go to the hospital and get what we call supportive care at the hospital. But getting tested isn't going to tell you anything or magically help you get better or magically help you get access to medication that would help you get better.